think you all agree. There are no words after a story like that, but just to kind of put a frame around that, what we're doing at OFA is we're trying to gather support around the nation to get stories like Ina's before our elected officials. The feedback we get from every elected official we've dealt with so far is that, yeah, they're hearing from every group, every interest group, even some individuals, but what they take away and what really at the end of the day I think sticks to them are stories like this. And it's shocking to me that, in the most wealthy nation in the world, these stories such as Ina's abound. And so how we are combating that, and Sean mentioned earlier, these clipboards over here, there's a little green section. That's for next weekend's Congress send-off day of action. What we're doing is we're going to get together at the Washoe Party Democrats office, and we're going to have clipboards, tons and tons of clipboards. And we're going to go, there will be maps leading you to a location, and we're going to go out to high traffic areas, and we're going to collect signatures from folks here in Washoe County, because we want to let Senator Reid know that he's not alone in this fight, that we stand with him, that we're behind him. And we have a big lift. The piano is at the top of the stairs, and we just need to give it that nudge and get it through the doorway and get ourselves health insurance reform. And with that, we would like to present to Mary Connolly, if she's here. Yay. Hi, Mary. We have some signatures. No, it's not terribly heavy, but. And actually, we're going to let Ina make this presentation. So here we go.
I have a very low voice, so I have to use the microphone to present this. On behalf of all the Organizing for America volunteers here in Northern Nevada, I would like to thank Senator Reid for his leadership in making affordable health care available for all Americans. We would like to present you, Mary Connolly, representing Senator Reid's office with more than 15,000 declarations. From Nevadans expressing their support for health insurance reform. I hope this gets as heavy as a piano.
Senator Reid is sorry he couldn't be here. But before he left yesterday on a flight to Boston for the funeral, we did a teletown hall on health care. Did anybody in the room get on that call? Yeah, that's interesting. We allowed folks to register on our website, and we had over 2,000 people register. We kind of think most of the folks who registered are folks who really aren't in favor of health insurance reform. So, and that's what this is about, is health insurance companies. But we had at one time about 10,000 folks on the phone. He took a variety of questions. We had an opportunity to find out what those questions were before he asked them, and we made sure, or before he answered them, we made sure that all those hard questions, all those myths that are out there about what's really in this legislation, what's really being considered, that folks had a chance to answer, ask those questions. So we talked about death panels and paying for abortions and health care for members of Congress and why do this now and what's going to happen to my Medicare, and all of those questions he answered. It was a fascinating experience. Number one, the technology is amazing. They dial thousands of people and we get to get them on the phone. It was fabulous. But even the folks that we know don't support health insurance reform, they were polite, they were great. I mean, I can't tell you how much we were pleased with sort of the conversation that occurred. So we're going to do another one in a couple weeks. We'll allow everyone to register on our website, so if you're interested in listening to that, I highly encourage you to do so. We'll advertise it just like we did this last one. He needs to hear from Nevadans. I proudly accept these signatures. I'll make sure they get to the right people in Washington and that he's aware of this. Thanks for coming out. I look at all of these people, I see lots of faces I know, but even better, I see lots of faces I don't know. So thank you for coming. Thanks so much. Well, you know, we asked that question too because I thought it was kind of a great conversation that folks could listen to. And our DC people that handle sort of the technology of setting up that, they're checking to see if that is something we can make available. So if you want to, give us a few days and then call the office and we'll find out. Thank you.
Well, thank you, of course, very much, Mary Connolly, and thank you again to Ina Robles for the wonderful story. Now it is my distinct pleasure to introduce to you Jessica Sbraza, who is here from the Reno City Council. Everyone, Jessica.
How's everybody doing today? Great to see all these Democrats here. I'm so happy, and my friends who are independents who are here today too to support healthcare reform. I want to start off by telling you this story because I think it's important on the word of getting volunteers out there and telling people why healthcare reform is so important. I had to go to the doctor a few weeks ago. I had some neck pain. I personally think it was because I'm on the phone so much. Has anyone gotten that pain from the phone? So I went to see the doctor and he starts telling me how he hates this healthcare reform, can't stand the president, going on and on and on. And at the end of the conversation, he starts telling me, you know, his woes, and he says, you know, I'm having to file bankruptcy this year. I'm really, really stressed out. And I said, well, why are you filing bankruptcy? He said, because I was in the hospital for a triple bypass. So anyway, I thought I mean, that's the reality here. I mean, that's the disconnect. We really need to get our word out there. And I want to tell you from a council perspective, how much money do you think the city of Reno spends on health insurance every year? A lot. For our employees. Take a guess. 16 million last year. So this just isn't about the insured. I mean, the uninsured. It's about the insured too. Because I'll tell you what that does. Because of the rising cost of healthcare, we're able to hire less employees. That's less police, that's less firefighters, that's, you know, less parks that are being built, preservation of open spaces, less teachers that are hired. I mean, that's reality, folks. That's how much it costs to insure employees. And wouldn't it be nice to get those healthcare costs down for everybody? Unemployment rate here in the state of Nevada, over 12% here in northern Nevada and 13% in southern Nevada. It's time that we get people back to work. And the way we're going to get people back to work is we've got to make it affordable for our employees to insure, our employers to insure employees, because the costs are just rising. I want to talk about the need for reform. 14,000 Americans lose their health insurance daily. Over the last 9 years, premiums have gone up 3 times faster than wages. Healthcare costs cause a bankruptcy in America every 30 seconds. We must enact health insurance reform this year because American families and businesses can't afford to wait. And I am proud at the City Council on Wednesday, just as a side note, we approved health insurance for all our employees. Those employees who register under SB 283 for domestic partners, they are finally going to have the equality that they still deserve, the same insurance that the rest of the city employees get. And I do want to thank our city council for doing that. Who said some Republicans don't have compassion? And I know I'm the only Democrat, but I am fortunate to work with some very compassionate people. Since the beginning of this debate, President Obama and Senator Reid have been abundantly clear about the 3 principles they expect in a reform package. The President is committed to health insurance reform that lowers costs, guarantees choice, and ensures all Americans have access to quality health care. And I want to talk about some of these points here today that are in the plan, because people are always asking about specifics. And one of them goes back to what our previous speaker said, Ina, about no discrimination for pre-existing conditions. In the past 3 years, 12.6 million Americans were discriminated against because of a pre-existing condition. No longer can this happen. And for those of us who do have health insurance, the costs of co-pays, deductibles for